In this video, we're going to talk to you about some safe and natural remedies to heartburn. Heartburn is one of these things that drives people nuts. And there is a multi-billion-dollar industry in the pharmaceutical area that's tied to heartburn, gastroesophageal reflux disease, known as GERD. And when you have these things, a lot of people will go to the store and get a pharmacy, for example, and get all these over-the-counter what's called PPIs to eliminate the acids in your stomach to try to get rid of this idea of heartburn. And when you get down to it, there is some safe and natural remedies to fix this dreaded pest called heartburn.
Well, when we think about it, those things called Nexium, Prilosec, Prevacid, Tums, Rolaids, Mylanta, etc. and otherwise, there is no such thing as a Prilosec deficiency or a Mylanta deficiency. We really need to look at the nature of what these drugs are and what they do and how we can find some safe remedies and solutions for gastroesophageal reflux disease, because these drugs, taking them on a daily basis, can cause some serious vitamin deficiencies like B12, vitamin D and calcium, which can decrease the mineralization of your bones and set you up for early osteoporosis or a fracture. Nobody wants to fall down and break a bone. So let's think about some safe remedies. Number one is don't overeat. The sphincter at the bottom of your esophagus, it's not a real true sphincter. It's just a little muscle flap. So when you overload your stomach, guess what? You stretch that sphincter and it causes reflux. That's right, reflux. Number two is chew your food. Your stomach doesn't have any teeth. So if you chew your food until it becomes soup, guess what? Your stomach is going to have an easier time on digesting that food because it's going to mix with digestive enzymes into a potion we call chyme and make it easier to pass through the digestive tract. Another real easy tip is to don't eat large meals late at night. Don't lay down on a full stomach. Why? Because that sphincter at the base of the esophagus is not a real true sphincter. It's just a little tiny muscle flap. So if you lay down on a full stomach, what are you going to do? You're going to reflux that food up the swallow pipe and cause gastroesophageal reflux disease. And then we do need to reach for a proton pump inhibitor or some type of relief because our stomach hurts. So a lot of times it is our standard American diet that is the reason we need to reach for a proton pump inhibitor, which can cause us serious side effects down the road if we take them every day. So let's get our lifestyle under control.
One of the side effects that's not talked about too much is even the proton pump inhibitor manufacturers and proponents will readily admit that it causes increased weight gain. And so that's something we don't need because that weight gain itself causes the stomach to elevate and puts more pressure on that lower esophageal sphincter. A couple things you can do naturally is one is probiotics. Probiotics are good bugs, good bacteria for your stomach. It helps process digestion and food can work better. That's number one. Another thing you can do is get a hold of a nice broad-based digestive enzyme. One that contains your protease, your amylase, your lipase, the enzymes to break down carbohydrates, protein, and fats respectively. So we want to make sure you have a good digestive enzyme to do that. Another one, and the last one we'll mention, is licorice. There are licorice chewable capsules that you can get that actually will help you digesting. Chew one of those before the meals, and that will help you out with the stomach acid issues. So we've given them some good tips to get this heartburn out of the way and quit overusing PPIs. Don't overuse those things. Let's begin to take care of ourselves more naturally, and we'll see heartburn go away forever.